Ms. Denise Phua.
I fully support the motion put forth by DPM and Minister for Finance on Singapore's COVID-19 response. Singapore's handling of the COVID-19 pandemic, while not perfect, is one of the best in the world. For those of us who have had loved ones suffer or even pass away in other countries due to a lack of access to vaccination and proper health care, we can appreciate how well the Singapore government has fared. However, I'm glad that the white paper not only highlights what we do well, but also where we fall short and how we can improve in the future. Today, I wish to focus on how we can better support persons with disabilities, or PWDs, in future pandemics. First, on the commendable efforts to support the disabled. Whilst the pandemic has affected many, PWDs and their families have been hit harder. Nonetheless, there are commendable sparks of great work being done. SG Enable, the main disability hub of Singapore, started a dedicated COVID-19 resource page on its Enabling Guide website. Together with MediaCorp, it facilitated CARE, or CARE initiative, to provide cooked meals, financial assistance, respite, and essentials distribution. The amazing support by Temasek Foundation throughout the pandemic is well known. Additionally, Temasek Trust partnered the 5 CDCs to launch a $4 million CDC Temasek Trust Lifelong Learning Grant to provide learning support in the form of devices and training courses, especially for those affected by COVID. The Ministry of Education also worked closely with MOH, HPB, SG Enable, and the special schools to run school-based vaccination centers for those who are still in schools. It learned from the SARS pandemic and now actively included students from SPED schools in its suite of measures to protect them. Dr. Lim Hong Hui and her husband, infectious disease specialist Dr. Leong Ho Nam, Eden School, Superhero Me and Arts Movement, and Lien Foundation developed an educational resource package to empower children and older PWDs. There are many other commendable efforts in Singapore. Elsewhere in other countries, I've been informed by disability volunteers and caregivers about some good practices in the disability space during the pandemic. Persons with disability were in one country, persons with disability were prioritized to be vaccinated with other vulnerables in phase 2 after the health professionals. Persons with disabilities were also earlier included in the home vaccination program. They can also get vaccination jabs while sitting in the familiar car, in car drive-thrus in one country. PWDs were also given priority lanes in the bigger vaccination centers. Those with needs can request for vaccination and use of private calm rooms to avoid meltdowns. Such were the best practices I hear from other countries, and I think something Singapore can refer to in our next future planning. Now, what can we do to better support persons with disabilities more effectively in future pandemics? I have 3 suggestions. Firstly, it is essential to adopt a universal design approach so that the vulnerable, including the disabled, are included upstream. This should happen at the strategic interministerial task force level and at the highest operations level, not downstream, upstream. The dedicated Center for Public Health and the forward planning team announced by DPM Wong yesterday must include an arm to look into the key vulnerable groups, such as the disabled, the young, and the elderly. It is crucial to recognize that the well-being of the vulnerable cannot be solely delegated to just one ministry, or depending on kindness of others, piecemeal stopgap measures. The voices of the vulnerable should be designed to be heard at the highest level, upstream and not downstream. Secondly, we need to include outreach to the disabled in the mainstream communication channels, such as television, newspapers, and useful GovTech WhatsApp updates that other residents receive daily. Many individuals are unaware of how to access disability hubs, such as SG Enable, and there may also be barriers such as language and IT proficiency. During the pandemic, we have heard of desperate parents who were so worried that what the quarantine arrangements of their children would be should the children get infected. For adults with disabilities above the age of 18 who need supervision and escort, many of their families do not know where to turn to appeal for special needs measures, such as being accompanied by a familiar adult before and during vaccination. Neither was it clear that they have options to be vaccinated either at a center or at home, not to mention the car drive-thrus that I talked about in another country. Whenever such cases come to my attention, I had often approached and relied on the kindness of public servants and office bearers such as Senior Pausek Rahayu Mazam to point me in the right direction. But outreach has to be more systemic. Outreach has to be more systemic, and affected parties need to be confident enough to have their needs heard and responded to. Thirdly, we need to develop a playbook for inclusive pandemic policies and practices at the national level. Besides involving the government agencies such as MSF and SGE for the disabled, there must be a platform to actively engage and consult with disability agencies and advocates to ensure that the unique needs and perspectives of the disabled and their caregivers and their community are highlighted. We need to tap on mainstream practices wherever possible and communicate clearly and widely. For instance, in matters such as applying for caregiver escort and supervision during vaccination and quarantines, and in offering the younger disabled options such as the public community vaccination centers, mobile home-based vaccinations, and even, if possible, vehicle drive-through centers. Set up a dedicated hotline staffed by human beings that is accessible for the major disability groups and their families. Identify and learn from best practices elsewhere. Allow for flexibility where reasonable at school, at work, or public places, because not all disabilities and support needs are the same. So universal design, including the disabled, upstream, not downstream, include outreach via the mainstream communications platform, develop a playbook for inclusive pandemic policies and practices for the future. In conclusion, sir, Singapore has done the best it could under the challenging circumstances brought about by COVID-19. Like many others, I feel so blessed to be in Singapore for a time such as this. With hindsight, let us better include the voice of the disabled and their proxies, such as their families and advocates, so that we can better support persons with disabilities in future pandemics. Let us all work together to ensure that no one indeed is left behind.